Hearing none, again, a roll call vote. Dr. Buchanan, if you will help us with that, please.
I got to remember to unmute myself. Ms. Wagner?
Yes.
Dr. Souza is not present. Dr. Shamiyeh?
Yes.
Dr. O'Brien?
Yes.
Mayor Jacobs?
Yes.
Dr. Hurt?
Yes.
Dr. Gocher?
Yes.
And Dr. Drake?
Yes.
All members present voting yes.
So you have the agenda as printed. And so the next item in the agenda is the Knox County Health Department's benchmark presentation by Dr. Buchanan. So Dr. Buchanan, if you will help us with that, please. Thank you.
I will. So Charity is pulling up the data, and I'm looking for my notes. Here we go. So well, I had a complete set of notes, and now, hold on one second. My pieces of paper got mixed up with each other. Well, I was going to start with the current situation, but I do not seem to have that paper with me, so Charity will probably be able to find it here in a minute. But yep, so I'm going to move on to the, okay, you're going to pull up the current, okay. So before you can see our current case counts, we had 100 new cases today. We have a total of 8,033 confirmed cases and probable cases, sorry. So we have 6,171 inactive cases, giving us 1,798 active cases. We've had a total of 294 hospitalizations. Currently, there are 47 hospitalizations. We have not had any deaths recently. We have a total of 64 deaths from COVID. You might notice the difference in language, active versus active cases. We've been calling cases recovered as opposed to inactive. The state made this change last week, and we have followed suit using inactive. So they changed the definition. So what they did in the past, we had been using a 21 days to consider somebody fully recovered. So some folks have lingering symptoms. They're out of isolation, but they have lingering symptoms. As we've learned more about COVID, it's apparent that really that's a shorter time frame, and it's more of a 10-day period when people are infectious and people are considered recovered. And so the state chose 14 days to be sure we capture all those folks. And so that with that change, we did have some change in our numbers. Our numbers should start looking like the state. So there's a drop off in our active cases and an increase in our inactive cases because anybody who was in between days 15 to 21 got pulled to the inactive section. So that's what happened over the weekend. So just it doesn't change isolation, doesn't change reporting, doesn't change our case definition, just a different way of determining when people are out of being called an active case. Let's go on to the first benchmark, sustained reduction or stability in new cases for 14 days. We've seen 5 consecutive red flags within the past 6 days, indicating a statistically significant increase in cases. Because of this, we're representing this benchmark as red. The majority of the new cases we're seeing are in the 10 to 20, or 11 to 20, and 21 to 30 age groups. As school is now well underway, this further stresses the importance of following the 5 core actions in every situation. And actually, if we look at the data, and I apologize, you don't have this before you, but we certainly can share it. But the 11 to 20-year-old age groups have had a 279% growth rate since 7/28. And a lot of that growth has been in the last couple of weeks. So we certainly are concerned about the growth in our school age and college age people and cases. And something for the board to keep in mind as we consider what we can do to help impact that. Is there anything else you want to say about that, Charity?
No, ma'am.
So we will go on to our second benchmark, community-wide sustained and increased diagnostic testing or decreased test result reporting turnaround time. Over the 14-day evaluation period, lab turnaround time continues to trend down at less than the 2-day average, which is really a positive thing. However, in regards to testing, we saw some red flags for the number of tests conducted, but they were not on 3 consecutive days. Last week, we had this benchmark at a cautious green due to flags we saw relating to the volume of testing. This week, the volume of tests conducted isn't rebounding as we'd hoped, leading us to represent this benchmark as yellow. For our third benchmark, sustained or increased public health capability. For this benchmark, we aim to initiate investigations for new cases within 24 hours and close contacts within 48 hours. We continue to be able to initiate investigations in this time frame. Because of this, our benchmark continues to be represented as green. With our existing EPI support team in place, we're able to handle our current caseload. However, we are looking to expand this team based on the larger volume of new cases that we've recently seen. And we will, of course, continue to evaluate this and make any appropriate changes as the situation evolves. One of the changes that just to make you aware of, as part of expanding this team, we are going to have 2 dedicated teams, one dedicated to Knox County schools and helping them with managing cases and contact tracing and making decisions around quarantine and isolation. And then another one that would be doing the same thing with, in conjunction with UT to assist as they make those really quite complicated decisions about quarantine and isolation is not as complicated because cases get isolated, but quarantining takes there's a little more nuance to that. And so with their case volume and just to give our team some more support, also, we're going to add some folks for that as well. For our fourth benchmark, healthcare system capabilities remain within current and forecasted capacity. We saw no flags regarding hospitalizations or ICU beds. However, we did see 4 consecutive days of yellow flags for ventilated patients. After speaking with our hospital partners, they stated their benchmark should be represented as yellow. Our fifth benchmark, sustained or decreased COVID-19 related death for identified positive or probable cases. Over the past 2 weeks, we have seen 10 deaths, with 7 of those reported in the last 7 days. Because of that, we are representing this benchmark as yellow. Any questions about benchmarks?
Any further questions or discussions on the Knox County benchmarks? Discussion, anything to add to that? If not, Dr. Buchanan, thank you for a very complete report. And next on the agenda is the University of Tennessee Medical Center's data update by Dr. Shamiyeh. And Dr. Shamiyeh, if you have those figures available, we appreciate your report.
Thank you. So
I'm working on it.
We're working on it.
Okay.
I'm not as practiced as Catherine is.
We've been new tech support tonight, so bear with us.
Understand.
well, we're not going anywhere. So if needed,
I'm gonna save it as a PDF real quick. I think I'm just, give me a second, sorry.
okay. I was going to say, I think I can potentially.
Yeah, if you want to drive Dr. Shamiyeh, that's fine. I'll try to get it saved as a PDF.
So we'll see who gets there first. So I believe if I can attempt to share my screen.
The host will have to make you a co-host and do that. Shouldn't be a problem.
Actually, I don't think we will, but
Okay, let me try it.
and here we go.
Did you get there first?
Yes, sir.
Okay, perfect. That, believe me, that'll go better. Okay. So, well, I think we're gonna, as usual, shows things similar, make conclusions similar to what Dr. Buchanan said. So next slide, please. So as we have seen more cases diagnosed in that younger demographic, that 11 to 20 and 21 to 30, we'll see that there's, I think the important point to make here is that the correlation still exists. We've seen that number, that 38, which was, had been 40, and when we started all of this was in the higher 40s. We've seen it ever so slowly creep down, but the correlation between cases and hospitalizations continues to exist. Next slide, please. So what this shows is that, and it's all consistent, is that we've accelerated again. So if you look at Knox County on the left, that 9, which was meaning 9 days to add that next 1,000 new cases, that was not on last week's slide. And so we had gone from 8 to 11 to 13 days to add that next 1,000, and now it's back to 9 days to add that 1,000. Then on the Knoxville district, you can see on the far right-hand side, that 6 we had projected, but we had not reached it yet. And the 4 on the far right-hand side is new. We do have a sense, though, that Knox County cases are driving that acceleration in the district as the population center. Next slide, please. So I think this is notable. And I'll show I believe it's my next slide where I show some age breakdown. But you see in this most recent week, we had 778 cases, which is our second worst single week that we've had in terms of cases diagnosed. And so over on the right, we would expect September, it's early, but to track is probably similar to July and August. In the district at the bottom, you see that it's not quite as dramatic in terms of the new cases, again, likely being driven by Knox County, however, but that downward trend has stopped, and now we're into more of a solidly upward trend. Next slide, please. So this shows the age distribution, and this is going back to August 2nd, and this data is drawn from the TDH, but it is for Knox County. And you see that the 11 to 20 age group has seen that that's the yellow line, has seen that significant increase in cases diagnosed. And what I think we would expect to see, if that group mixes with an older, more vulnerable group, then what I think you would expect to see is, and it's not even really about the vulnerability, but it's just about the mixing, is those other age demographics to be pulled up gradually by that same line. It really depends on who associates with who at that point, but clearly dramatic in terms of the difference in the different age groups. Next slide, please. So this we show every time as far as the doubling day growth rate. What I'll simply point out here is if you look at the lower right-hand side, that's the blue is the doubling day rate, and the yellow is a 7-day average, and it looks like they're close to crossing, which would be the first indication that it may start to go back up again. Next slide, please. This we show as far as the different counties, and the Knox is what you've already seen in the lower right, but then Hamilton, Davidson, and Shelby, again, potentially driven by the age demographic, but we are definitely, this is the first week since we've been showing this that we look distinctly different in our trajectory than the other population centers. And actually we've had the highest, the scale is different on the left-hand side, but we've had the highest growth rate of the four, is my understanding. Next slide. Then hospitalizations, Knox County and the THA Knoxville district. The hospitalizations in Knox County increased actually a little more than I might have expected at this point, but it's certainly tracking consistently with the increase in cases. On the right-hand side, you do see that August, I believe we showed that last time, August was certainly a better month than July. But at the current time, tracking that September would potentially be a worse month than August. Same exact pattern in the district, although again, not quite as dramatic, but going from 34 to 43 new hospitalizations. And then next slide, please. And then the census, remember last slide was new hospitalizations. This is the number of patients in the hospital on any given day. And I always tell you that this is the one that's most subject to variances in the data, where if hospitals didn't report in a particular day, that could be, or more than one did not, that could be a particular reason why it's jagged. So we ended at 125, which notably, even though there was some up and down, was where we were last week at the same time. Next slide, please. So this just, though, projects that we're projecting a little bit higher into early October. And then to show the last three projections, next slide, please. There you see the blue, which was August 26th projection, the orange, which was September 2nd, and then the pink or red, which is the one from today. Still significantly less than when we were truly on the way up on the left-hand side of the graph, where we were projecting close to 400 in a similar time frame, projecting in the future. Next slide, please. So we went ahead and threw this in at least one time. Dr. Buchanan has made it clear that there are some definite concerns about using positivity rate, because we just don't know how reliable, if I understand what she said, is the denominator in that. But I think just from a trending perspective, the red is an average and the blue is a precise day. You can see that, I mean, for apples to apples, even if it's not perfect, you can see where when we were in that July timeframe where we had increased concern, we had the average positivity rate over 10%. Then we had a nice dip, and then that seems to be steadily increasing again, with single days that are in the 11-12%, but still the average is creeping up. And so again, not implying that this is a perfect metric, but we had the ability to show that, and since it's been discussed, thought we would. And next slide, I believe that's, so then I just pulled together some key data points, all these graphs and lines. And so I just thought this would potentially be useful. So we've had 2 weeks of increased case growth. This most recent week was our second worst week of case growth since the beginning of the pandemic, but it's clearly driven by the 11 to 20 age group, and Dr. Buchanan had also mentioned the 21 to 30 age group. Hospitalizations are trending in the same direction as case growth, but still certainly manageable, but above the threshold of when we transition, still above the case threshold of when we transition to yellow. And we've had the worst case growth of the four major population counties that are tracked: Knox, Davidson, Hamilton, and Shelby. I believe that's my final slide. If you could hit next slide. Yeah, that's Dr. Gocher. That is my report.
Dr. Shamiyeh, thank you very much. I had a couple of questions, Dr. Shamiyeh, that on your, I guess the first or second slide you had the hospitalization rate per 1,000, and we've gone from being in the 40s to the high 30s. Is that significant? Is there any significance to that? Does that maybe imply a less virulent strain that's in the community, even though we're having more, or is there anything we can ascribe to that?
I ascribe that as we've progressed and as that age slide showed, I mean, we have definitely been testing more of a younger population, or at least finding a lot more positive cases. And we know that, at least based on our understanding of this virus to date, those people are not particularly likely to generate hospitalizations. It's more the people that they may mix with. It's not impossible that the younger folks can end up in the hospital. And actually, when I was showing you every week our hospital age cutoffs, we had people in their 20s in the hospital at any given time. But across the population, they're less likely to be in the hospital. So I think that starts to drag that number down.
It's more a factor of the denominator then. The new cases are in that younger demographic.
Yeah, I believe so. I mean, to me, a lot of the significance of those cases is who else they're potentially mixing with, which is a concern. But I also, Dr. Gocher, I mean, there's still a correlation here. That's part of why, I mean, you could argue at this point, why even continue to show this? But there's still a pretty significant correlation between cases and hospitalizations. And that's part of what allows us to be able to have some sense of what the future holds related to hospitalizations.
And I had one more question for either you or for Dr. Buchanan, and that has to do with that positivity rate. Does the denominator of the positivity rate include the elective surgery and endoscopy testing that's being done at every hospital? Because those patients would not have sought testing because of symptoms or contacts, but merely because they wanted to have elective surgery done. Are those figures included in the denominator?
So Dr. Buchanan, I'll start. My understanding is that those have never been pulled out separately in any sort of data that's been collected. I have another comment to make, but Dr. Buchanan has potentially a better answer for me. So Dr. B?
Right. So yeah, the short answer is any test that's done in Knox County is included in this data. And that would include those preoperative tests that are being done. And so, yes, they're in there. They're not pulled out separately. With the volume of testing, it would be really challenging to sort those out. So those are reportable like everybody who does a COVID test, whether it's positive or negative, they're supposed to report it to the State Department of Health.
I mean, I think that's an important factor because we've heard at least discussions that maybe the positivity rate is skewed because we're only looking at patients who come in with either symptoms or close contacts to be tested. And these are people that are completely asymptomatic and with no close contacts, and they're just coming in to have elective surgery or endoscopy done, and they're getting tested strictly for that reason. So that gives you a better sense of the what's going on in the community outside of people that are actively symptomatic. That's an important thing, I think.
I think that's a good point. The volume of these tests, I mean, we've been doing this for months now, and there are very few, I don't think it's necessarily every procedure, but there are very few procedures that are elective that don't get those tests, and those almost serve as a general population screen. And so the volume is significant. You think about how many procedures happen in a hospital in a month on the outpatient setting, and the vast majority of those are all getting tested.
So if you're seeing an increase in positivity, it's certainly real.
Yes. Yeah. I mean, I think so. But again, I don't want to lose sight of the fact that Dr. Buchanan has had concerns just about on any precise moment how accurate this is because of issues with the denominator. I really showed it today for the purposes of trending, simply because whatever issues are present have been present. And so it may be directional data.
Thank you for a very complete report.
Thank you.
Any other discussions, questions, comments regarding the UT Medical Center's data update? If not, again, thank you for a great report. And the next item on the agenda is going to be our educational institution updates. And so we're going to call first on the University of Tennessee. And Dr. Plowman, we'd like to have you address this if you would. And thank you.
Dr. Plowman, you're still muted.
Thank you for having me here. I was here a week ago, and many of you probably listen to the regular twice a week updates I do, Tuesday and Friday, 11:30. And so today I'll keep it short. I'm gonna give you two sets of numbers. I have no visuals. Oh, you know what? I don't need those. We can look at it. That's fine. So the number I want you to look at here is today's numbers is active cases. We have 616 students who are positive right now. A week ago, on September 2nd, that number was 303. That, in some ways, sums up where we're at. The other one, the next slide, I believe that you have, is the number of people who are self-isolating. So, and they are either quarantining or isolating because they have a positive test. Last week when I was here, I told you that total number on September 2nd was about 730 students. As of today, it is 2,000. It's almost 2,000 students. So we've doubled the number of positive cases in 1 week. We've almost tripled the numbers of students needing isolation. And that's all I'll need of the slides. I won't go into the next one really. You can see those on our website. So I just want to talk to you a little bit about where we are. Clearly, we've got to make a change in our environment, changing behaviors. And I've talked to the campus about this week. First thing that we've done is today we notified residents in one of our dorms, Massey, that they would be moving out, and we will turn that entire dorm into an isolation dorm. That will give us 580 beds. We also have isolation beds in the Holiday Inn. So that will, and at that point, we will be testing every student before they move out of Massey to make sure we're not placing a student who tests positive and doesn't know they even have it in another dorm. That will take us obviously about 2 weeks to get that dorm empty. To be at a place where we can manage, be at a level where we can manage the number of positive cases with the rooms that we have. Additionally, I told the campus just this past week, we're looking at what other universities have done and putting all options on the table. Many universities have taken sort of a 2-week break and said, let's just kind of stop what we're doing here a little bit in terms of interactions and meetings and events and take a breath and see if we can't get ahead of this. And so we're looking at all sorts of possible options. Once we empty Massey, we're going to begin a systematic surveillance testing approach on campus. So we'll be able to isolate where before we see a cluster, go in and test and remove people and put them in the isolation dorm. So I'm going to leave it at that right now. That's just a quick summary, but it's not good news. I'm very grateful to the partnership with Knox County Health Department. They've been wonderful. The state's been great. Our goal is to help kids stay on track to graduation and be safe, healthy, and stay happy too. We also have a big commitment to the community. We don't want to overrun the healthcare systems. That's a concern. And we don't want to drive the numbers up, which it looks like is starting to happen here in the county. So I'll just leave it right at that. And if there's a question, I'd be happy to handle it. I think I've got some noise going on.
Other states the presidential race is less certain. Plus, we could see a lot
Any
of
questions?
litigation over
Yeah,
ballots.
Chancellor, thank you for your report and for all the very hard work that I know that the university has done, your team and everybody there. Just out of curiosity, how many kids do you have on both on campus and off
Yeah.
campus now? It's,
So
I
we
think that's
have,
700 or so.
We have
Is
a
that
total of 30,000 students, roughly, a little over that. About 7,700 on campus. 6,700 are in the dorms,
Okay.
and about 1,000 are in Greek houses. And honestly, our focus right now is really trying to help students who are off campus and are, they're self-isolating wherever they live. And then try to manage it on campus so it doesn't spread through the dorms at a faster rate than we can handle with the isolation beds.
Thank you.
Dr. Plowman, thank you very much for your report. Are there any other questions, comments, questions that you would have for our chancellor? If not, Dr. Gregg, did you have an additional report on the University of Tennessee from your standpoint?
No, sir, just here to answer questions if needed.
Okay. Any questions for Dr. Plowman? Any questions for Dr. Gregg? If not, thank you all for your efforts.
Thank you all.
Oh, this is a Herculean task, and thank you all for all your efforts in trying to manage this. If there's no other discussion on UT, let's go to the Knox County Public School update. And Ms. Wagner, if you have some information for us.
Yes.
Thank you.
All right, Charity is pulling up your
There we go.
presentation.
Okay. Okay.
Lisa, begin whenever you're ready.
Okay, next slide, please. So this is the COVID dashboard, and it's from September the 2nd through September the 8th. And so we have a total of 45 active cases from September 2nd through September 8th. Next slide. And this is basically, the same thing that we discussed last week. September the 2nd, we had 29, and on the 8th is 31 active students and 14 active staff. So we have a total of 47 students recovered and 76 staff recovered, which equals 123. Next slide, please. So this just gives you a broad overview of from September 2nd through September 8th of the number of recovered staff and recovered students. And so we have 751 in isolation or quarantine, 78 staff in isolation or quarantine, which equals 829 from September 2nd to September 8th. Next slide. And as you can see, the isolation for students has gone up somewhat. So like on September the 7th, it was 573, and yesterday it was 751. And the COVID dashboard is updated every day at 4 o'clock. Next slide. So if you look at the metrics for September the 8th, we have 4 green metrics and we have 2 red metrics: custodial support staff attendance and substitute availability. Now, we have been consistently red for subs, and so we had a small percentage on the 8th of custodial support staff, which went to red. But as of today, the custodial support has went to yellow. And also, okay, can you go back to the other slide? So in an effort for the substitute availability, we have tried to incentivize substitutes to work, more often, because the availability of subs has been, somewhat low. So we're offering a bonus of $300 to $500, depending on how many days you work per month. And so if you want $300, you have to work 10 to 14 days. And if you want the $500, you have to work at least 15 days a month to get $500. Next slide, please. This is just the daily metric, student attendance rate. And so for the red, we look at the attendance rate and continual service interruption of greater than 10%, combined absences, and the fill rate. The fill rate is for substitutes. Next slide, please. So Cedar Bluff Middle, it moved to online learning beginning Tuesday, September the 8th. And the students will return for in-person instruction on September 15th, unless otherwise modified or notified. The decision was based on the district's metric of substitute availability. And so the online learning has been implemented in order to ensure that students continue to receive high quality instruction. So as a district, we're facing some challenges due to the number of staff being quarantined. Not saying that the staff are ill, but when you have a positive case, then the number of people around them that are within 6 feet for 15 minutes or longer are considered contacts. And so this is going to be a continued challenge for the district as teachers who are not sick but have to quarantine. And they can teach virtually, but we really need them to be in the classroom to manage the students. So this is why we are seeing an increased need for subs at this time. Next slide. I think that's it. Or is it not? Is that it?
Sorry, yes, that's it.
Okay. I'll take any questions if anybody has any.
Wagner, thanks very much for that report. Are any questions, comments about the Knoxville County school report?
Stop sharing.
Oh, well, I didn't have somebody want to go back on the
Okay, that's right.
This is Maria Hurd. I have a question.
Yes, ma'am.
And Ms. Wagner, thank you for presenting this information. And you may have shown that I didn't catch it if you did. So I understand the metrics in terms of, green, yellow, red, etc. My question is, can you share with us, or is it on the dashboard regularly, what the actual attendance rate is from day to day, so we know how close we are as a county, moving from the green, let's say, to the yellow, or back and forth, so we actually have the numbers, not just the color-coded benchmark.
I don't think the attendance rate is on there. I have to get back to you on that. I'm not quite sure, but I don't think the attendance rate is on the dashboard.
Okay. Yeah, I'd be curious to know what it is, like how comfortably is the school system in any zone, or uncomfortably for that matter. Maybe they're the red zone, let's say, for substitutes. I'd like to know how close the system is of getting out of the red zone.
Okay. So are you talking about the attendance rate for the students or the staff, or combined for students and staff?
I think it'd be great to have all that data, honestly. So, yeah, but I was initially thinking of attendance rate for students.
Yes.
That's my understanding. Your first metric, that's what you're measuring when you talk about attendance rate. But I think it'd also be helpful to know the actual data for each of those.
Okay. Yes, ma'am.
I don't know what my fellow co-members think about that, but just thinking out loud.
I would be interested in knowing what the attendance rate is for in-person versus online. We know there's the percentage of people that are online. Ms. Wagner, do they have a good attendance rate for online learning? And does everybody show up? And is it working okay?
I'm sure some parents. I'm sure there are some issues with, some parents or students learning the mechanics of online instruction or how to log on and stuff like that. But we do provide support for that. So I will have to get you a more definitive answer next week, if that's okay.
Sure. I'm just kind of curious as to how it's working, and whether people are staying online the whole time, and how you kind of assess whether somebody is present or absent if they're online.
Okay.
Yeah. Okay. Any other questions, comments? regarding the Knox County schools?
Dr. Kocher, I had one. This is James Shamiyeh. So, Ms. Wagner, when a student is sent home either because they've been diagnosed with COVID, or I guess much more likely is that they are a contact, and so now they're in quarantine.
Yes.
Just having talked to people who've navigated this is not an easy thing to manage within the home. And obviously the management is a little bit different if the child is COVID positive versus if they're simply in their quarantine window. But how is that a specific phone call with a parent to say this is how to do it? Because, and I should have asked the same question honestly to the folks from UT, as they have some of their college students who are choosing to do their quarantine time back at home. But how specific is the instruction that the parents get about how to do this correctly?
Okay, so when we call the parents about their child is quarantined for 14 days, we tell them to monitor their child for symptoms of COVID, and to take their temperature every morning or every day. And like if they have to go to the doctor or somewhere like that, they need to make contact with their PCP to let them know that their child is in quarantine, and if they have any symptoms. And we do recommend testing 5 to 7 days after their last exposure date to the case.
Okay, so let me ask a follow-up question, and this may be also Dr. Buchanan, if you want to at some point jump in, either one of you. So if it is a child who is old enough to not to really largely care for themselves, and it's a contact, it's not COVID positive. I mean, are they in their room a lot of the time? If they're out and about in the house, is everyone instructed to wear a mask? My biggest concern, both from the college standpoint and from the school-age children standpoint, is the spread within the home.
Yes.
That's where I think from a broader public health perspective, we're going to get in trouble, because then that person at home doesn't know they have it and they take it to work.
Mm-hmm.
And again, masks are always our safety net, but just what is that child really, how are they interacting with their family if they're old enough to be somewhat independent?
Yes. I don't know how they're interacting with their family. I do instruct the family that, if they're around each other or in the same room, that they need to wear a mask. That masks are important, and also practice the 5 core actions as well. So.
This is Charity jumping in too. When we talk to the individual cases for their contacts, we do educate about being able to separate within the household if possible, and kind of give the guidance on that, much like we talked about, I believe, last week with the sorority situation. So how they can do that as much as they can, and then that if they can separate completely, meaning not share any common spaces to include bathrooms and things of that nature, then we'll start counting them almost essentially as a non-household contact from that point. From the time they separate, we'll start counting their quarantine period. But that is good information. We'll make sure that Ms. Wagner, we get you more information on that stuff to share as well when you're talking to the students and your team are talking to the students. I think there's a letter that has some of that information in it as well. But we'll make sure does that go out with those parents at this time? I can't remember where we landed on that, Ms. Wagner.
Yes, we started sending those letters out today.
Okay.
Mm-hmm.
And just the final, thank you. So final follow-up question though, it almost seems to me like this is more straightforward if the child or college student is COVID positive. That seems to be probably, that message is easier to send. But if they're simply a contact and they're mixing in the household, and let's say on day 5 or 6 they become positive because they were a contact, so that's the whole point of quarantine. Mm-hmm. And if they're not kind of following those 5 core actions within the home, and maybe they never develop symptoms, but someone else in the family who's more vulnerable is exposed and does, and yet never even knew that the student was positive. And so, I mean, it just seems inherently it's going to be harder to follow those types of rules within a household when the student has simply been a contact, but theoretically it may be just as important.
Yeah, and the same guidance on our end is given. We talked to everybody about that, just again, trying to protect your household members. But it is probably harder to conceptualize when you're not the case and you've maybe just been in close contact outside of the household to someone. But I do agree with making sure that we have that as a very strong message for those folks, because it is challenging. And it's very challenging, obviously, when you have the little children in the house, no matter what.
Of course, yeah. No, very good. Thank you very much.
And thanks, Ms. Wagner, for your report. Any other questions, comments, discussion on Knox County Schools report for this week? If not, again, thank you. And the next item on the agenda is the COVID-19 face covering regulation 2020-1, again for review and discussion. Dr. Buchanan, would you like to lead out that discussion, or where shall we take this?
So we continue to hand out masks. We continue to respond to complaints about people not wearing masks. We have 3 to 4 complaints from non-food facilities, usually residents complaining that a facility is not enforcing the mask mandate, and about 4 to 5 similar complaints from food facilities, where patrons call in and say some place is not making people wear masks. Our response to that is always to reach out and educate and inform and encourage that facility to facilitate people wearing masks in their place. But I continue to see people wearing masks regularly when I'm out and about running errands. But complaints have kind of leveled off. They're not, so, I mean, and it varies whether a business owner is enforcing mask wearing or not. Most of the places I go, signage is there. Most people are in masks, but I also have kind of a small circle of places that I go.
Any other comments, points of discussion about 2020-1?
Well, I'll just bring up the fact that I think, just to tell the public, I think it's still a little too early at this point for us to say as of tonight that we could stop having our mask regulation. I think we see that we have some issues ongoing right now, that it does appear to help us. I know that we get a lot of information in our emails from various members of the community showing different studies with different data points, but it's the one thing that is basically non-economic. It is, everybody now has masks pretty much. We are getting into the habit of using them. And I think we need to continue at this time until we can get a definite downward trend, and see if we can get this getting slowed down sometime in the next few weeks and or months. We just don't know what the timeline is. People want us to say, what's that one data point that will cause us to rescind this? I don't think there is one. I think it's looking at the whole picture, looking at multiple benchmarks, and looking at what our community is doing. And in general, just from personal observation, most people are observing this. We do have some issues in certain areas, which I'm going to reserve comment until we get to the next line item to talk about that. So I think we just need to let the public know we need to continue what we're doing, and please be patient and forge ahead.
Any other questions, comments, discussion?
I would like to say, I don't have access to the data yet, but I've heard about a statewide survey that went out to business owners throughout the state, including Knox County and Knoxville, in that the majority of business owners replied that they were in favor of the mask mandate, close to somewhere between 75 and 80%. I don't have that access to that study, but when I do, I'd like to share it with you all. So that is at least what I've heard. And I think that should be an encouragement to us. We really understand that the economy has been hurt by the pandemic, and the masks are sometimes cumbersome, and they're a pain. But the majority of people we've seen, just anecdotally and empirically, and then again from this survey that was done, the majority of people understand that it's a necessary, cumbersome obligation to keep each other safe.
Thank you, Dr. Hurt. Any other questions or comments or discussion about 2020-1?
Just a broader comment about kind of the 5 core actions again. I think that one thing that, look, we're going to learn as we go, and some of this is going to be observational, but I think one of the things that we may be learning from colleges, and I'm not talking about just our university here, but I'm talking about, we're hearing about this colleges across the country, but I think there's an understandable thought that the 5 core actions are less likely to be followed in that college age community, in that environment. But what we're seeing is case rates that are just really impressive. They're stunning how fast that now that it doesn't say that these are people who are particularly vulnerable that are going to get particularly sick, but it does speak, and I think my opinion of that is, what I infer from it is it speaks to the infectiousness of when you test the way you're supposed to test, when you do the surveillance the way that has been described, that it's very easy to spread. That still seems to be true. Now, what it doesn't speak to is what's called the virulence of it, or how sick those people will get, and more from my standpoint, who that then gets spread to. And that gets back to the whole thought about, community masks are very important to me for the reasons that have already been articulated, but it's also going to be some of that activity within the household, where we all know that, let's just face it, wearing a mask in your house is a very difficult thing to do. But I think that the college data does suggest that if you look at the case rate in a college, if you put a bubble over that population, it's about a 2% positivity rate in a very short period of time.
Dr. Shamiyeh, have you seen the study from Vanderbilt that hospitalizations versus masks, and they are doing some data with hospitals that get patients from counties that do not have the mask requirement compared to counties that do have it. And it's significant, the difference in hospitalizations.
I have not seen that. I'll definitely try to look at that between now and next week's meeting.
Thank you.
Any other comments, questions, or discussions on 2020-1? If not, thanks to everyone for your input on that. And the next item on the agenda is COVID-19 suppression in bars regulation for review and discussion of both 2020-4 and proposed 2020-5. And who would like to open the discussion on those?
Well, I'll go ahead and throw my hat in the ring. One of the things I've done in the last few days is try to talk to law enforcement to see how we're doing in our community vis-a-vis our regulations, and what are the issues from a law enforcement standpoint on trying to follow what we have already placed in regulation. And what I've gotten in talking to the top levels of our departments locally is that there are several issues that they run into, and just some information that they gave me was that during the first week or so of this, that there seemed to be pretty good compliance in our community, that they would try to educate, at least within the city and within the UT community that this regulation was in force and to please try to follow this. And what's happened is that has gone by the wayside. There are multiple businesses that are not following our regulation. That is occurring in areas around the university and other parts of the city. And because of this, and in asking law enforcement about that, said, what can you do? So, well, the issue is, it's difficult at that moment to say, okay, do you fit the criteria based on the less than 50% sales? And they'll throw out something saying, well, we actually just meet that, and there's no way to prove it. And what's happened is the places that have been our main area of concern are open and are remaining open. Now, the other thing that I've been able to glean in these discussions is that these folks in law enforcement feel that, again, just as we have seen through our data, that community spread is not from congregating in business locations, it's from personal gatherings, especially in the university community. And so they feel, I think at this point, my way of bringing this up is that we have a great intention. We're trying to do what's right. We're trying to keep people safe. But the function of this regulation is it's not working. It's not being enforced. It's not going to be enforced. There's no good way to do it, and that we should know that. And it's not that they're not trying or not trying to educate and go out there. We do have a number of law enforcement that are trying to do that for us. Our health department cannot do everything. So I hate to say this, but I think we're at a point where continuing with the bar curfew may be a moot point, that we can continue it all we want, but if you will go out this evening at 10:30 and drive in certain areas of our city, you will find a fair number of places not following it. And it's the places that we have been talking about that we want to have students avoid, et cetera. So I'm just at a point personally of saying that it may be time to let this one go, just because of the facts of the matter. It's not being enforced. I hate that. It's, we could keep it on the books. It's not going to change what they're doing. And, again, I talked to some folks this afternoon and I asked about certain areas around the university, and they say they're open. They're selling. They are doing what they do. And I think owners have decided they've got to try to stay in business. And yes, they want to try to do what they can, but they're not going to close. So I don't have direct numbers. Again, I'm just getting this from them. I got a report given to me Saturday night. Somebody contacted me about a certain place downtown at 10:30 at night, wanting me to do something. And I called KPD and left it with them. The unfortunate thing is they can go out there and try to educate them, but they don't have a way to close the doors or change things immediately. So at this point, I think us as a board, really working on the 5 core actions, educating the community, continuing the mask mandate is where we can make an impact. I don't think, no matter what we do with this regulation, we're going to have an impact. And I hate that, but that's the reality that I'm getting in my discussions with people in the know. So I want everybody to know that. And, going forward, I think we may just need to let these drop as of now.
Any other discussion regarding that?
Bob, just one comment on that. When we look around the state and look at other metropolitan areas such as Davidson County, Shelby, and Hamilton, who've had success, as we can see, in reducing their numbers. The health officer in those counties has utilized, or the health director, either one, has utilized some of the authority that they have to, I'm not sure if they've closed those facilities or cited them. We haven't gone down that road, Mr. Sanders. There are some authorities that the health officer, or primarily probably more the health director authorities, that could come to bear. That's just a question. If somebody's not following the regulation of the Board of Health.
Yes, both as health officer and health director are two separate statutes that come into play, but both the health officer and the health director both have authority in that situation. So probably the health director's authority is a little more on point. The health officers, the reasoning under the health officer's authority is really more related to unsanitary conditions. So you'd have to define what unsanitary is in this context. But health director's authority is pretty much on point as far as being able to impose restrictions or put some teeth behind any regulation the Board of Health has if necessary. And we've talked about it a little bit in private about, you know, various instances where you could do it on the front end of going to court versus the back end of going to court, and depending on how serious the threat is, and we can guide you through that if necessary.
Right. So, I mean, that is an avenue. The challenge with that is, I mean, that honestly, that's a lot of, we do occasionally exercise the health officer's authority in relationship to, for instance, a TB case that doesn't want to comply with treatment. That's with an individual, and even that is it's a lot of work. So, you know, I don't know about the feasibility of being able to do something like that to scale where it would be impactful. Does that make sense? Where it kind of becomes whack-a-mole. You know, if you get one, you've got others that pop up. Not a reason not to do it, but I mean, it is out there. I haven't exercised that, and you know, it certainly could be challenged. You know, there's a process. The individual and/or facilities obviously has all the rights to be heard and to go through that process. So that's out there. We haven't done it, but I know they have done it in the other jurisdictions.
Mr. Sanders, could you describe that process, please? And also, what sort of liability would that potentially put Knox County under?
Sure. Probably the easiest way to do it is simply, and I apologize in advance for being somewhat boring, but the easiest way is just to summarize the statute for you. So the statute, I'll try to paraphrase as I go along. First section of the statute, and I'm referring specifically to TCA section 68-2-608. Whenever it appears to the county health director that a condition or activity exists or is threatened that may violate laws, regulations, resolutions, etc., the health director may issue an order for any of the following: cessation of the activity, removal of the condition, revocation, suspension, or impositions on conditions on a license or permit. That would be within the director's authority. Or they can, if they find that this is a separate section of the statute, when a condition or activity exists or is threatened that in the opinion of the health director causes or threatens an imminent or immediate danger to public health, they can essentially order the closure of a business without, and then go to court, or they can go to court first and get an order if they don't find the threat is as immediate. So those are essentially the three methods that the health director has at her disposal. As far as the liability of the county, the question would come, did they follow procedure properly? And do the facts back the action up? It's hard to answer that in a hypothetical.
I understand, but basically my question is the county's going to get sued because each one of these cases has to be potentially, but each one of these cases it's a case by case in this situation, correct? That
it is certainly case by case, and I think you are accurate in saying that a business owner will almost certainly their first call is going to be to their lawyer, but whether they will be able to successfully sue, I certainly hope not. That's my job is to guide the health director through that process and hope that we come out doing this with all procedural safeguards intact so that there is not a successful lawsuit. But of course, I can't prevent someone from filing one on the front end.
And at what point would the sheriff's department or sheriff's office, or the police get involved?
So that's sort of a separate issue. Any violation of the Board of Health's orders is a criminal offense. It's a misdemeanor, but it's up to each individual law enforcement agency as to whether or not they choose to enforce. What we're talking about, the authority of a health director or health officer, is outside the scope of law enforcement. Now, if a law enforcement agency wishes to cite a business owner or operator for violation of a Board of Health's orders, that's within the discretion of the law enforcement agency. But they've got to choose to do that. And we don't, this Board of Health, nor my office for that matter, do not have the authority or the ability to order any law enforcement agency to do that. Does that answer your question?
Yes, sir. Thank you.
Any other questions, comments, or discussion?
Dr. Gocher, I'd like to specifically address some of what Dr. O'Brien said. And what I'm going to do is I think we have a natural tendency, because of our probably nature of our training, is that we get right into the details very quickly when we discuss things. And so I would like a conversation that I think we've needed to have here for a little while. I want to try to have that now and take us a little more at a 20,000 foot view. And what I mean by that is, well, first of all, from a compliance standpoint, we've had a big win, and that's been on mask. I think we've said that repeatedly, and I personally, and I know it can be controversial, but I've felt like that's the most important of the 5 core actions. And so from a compliance standpoint, we've had that. But for these other things, and what we're specifically talking about here is a 10 p.m. curfew. We find ourselves in this environment where we're not sure to the extent of which things are going to be actively enforced. And it does sound, the conversation we just had, it's going to be complicated to do so. And what my question philosophically to this board is, we could find ourselves in one of two kind of philosophical positions. One is that we're not perfect at predicting the future, but we do have some experience with this virus at this point to have a sense of what's going to happen. And so we've taken this very measured approach, trying to be proportional to the situation, trying our best in a very difficult environment to be fair, and have, create things that may be somewhat difficult to enforce. But we're trying to do it gradually. The other fundamental approach to some of this is that, some of this die has been cast, and guys, just looking at what I have seen and what I expect, I expect that we are going to see, again, I may be wrong, I hope I'm wrong, but I think we're going to see worse numbers, including worse hospitalizations, than we saw midsummer. Doesn't mean it's going to be catastrophic, doesn't mean it's going to be unmanageable, but we're going to be talking about worse data for, I think, a period of time. And so the other philosophical approach is that we wait and we do more if forced to, if we feel like we have to, we do more definitive things, but do them later more as a bailout. And knowing that we've got that 4 to 6 week lag. But for example, it is, to Dr. O'Brien's point, at 10:30 p.m. at night, not knowing somebody's inside their books, we don't you can't really react at that point. But a closure is cleaner. A closure is something, and let's not forget, we did have a bar closure briefly, very briefly. And so there is that precedent. But I think we're going to keep dancing around all these details. And I guess the broader question is our role to try to just every step of the way do things as data gradually gets worse, or is it to let it play out to a certain point and then react when we are really getting concerned? I think that's the root of this issue, because the environment that we're trying to do this within, and that's, I know this is the health board, but it's a political environment, it's a law enforcement environment, it's an everything environment. It is complicated. And so I don't have that answer, but I turn that over to, I think if we don't discuss that, then we need to have that discussion in these coming weeks, now, to prepare us for these coming weeks.
Dr. Shamiyeh, thank you for those comments. I have a comment about this, because when we went from closing down bars to having them open at 10 o'clock, there were several, in my subjective opinion, there were several responsible people that were encouraged by this, because at least we gave them a window to try to earn a living. And some of these people, I think, and I don't know by firsthand experience because I haven't been out looking around, but I think these people, many have remained responsible, and their businesses may be suffering because there's just a lot of renegades out there that are not obeying this. And it may be better for all involved to make this an advisory discussion rather than a mandate. And I agree with what Dr. O'Brien has said from a practical standpoint of enforcement and the very negative of going legally down the road with a lot of lawsuits and closures and terrible, really terrible overall outcomes that none of us would like. I mean, it may be better to go advisory on this and watch it very carefully along the lines of what Dr. Shamiyeh said, knowing that that there's going to be some increase in cases as a result of this. But if our owners, if we did this, were responsible with masks and responsible with attempts at social distancing, it would certainly go a long way. But I remain frustrated personally by this, and I think others are expressing that same concept. I think if you try to clamp down, the harder you try to clamp down, really the more difficult it's going to be. Thoughts about that?
Yeah, this is Maria Hurt. I'm sorry, someone else going. So here are my thoughts. What I heard you saying, Dr. O'Brien, is that law enforcement at times feels like they have their hands tied, even in terms of educating people who appear to be non-compliant with the regulation, because there's question about where does this business fall in terms of being having to comply with the regulation. 50%, not 50% food sales. I would encourage us all to remember that the reasoning behind this type of regulation is that we know alcohol consumption, prolonged alcohol consumption, especially late night alcohol consumption, inhibits people's interest in following the 5 core actions. And when people don't do that, we see a rise in cases and hospitalizations. So that's kind of the background of why this is a reasonable regulation that we didn't come up with out of thin air. This has been recommended numerous times, White House Task Force, CDC, etc. We recognize it's not the business, it's the activity that happens within the business. And again, I want us all to consider, is it really a 10 p.m. curfew on only bars? What's equitable? Again, I want us to consider that if we think alcohol is the problem, which you may disagree with me, but that's my my professional take on the problem. If we believe alcohol, late night alcohol consumption inhibits those 5 core actions, then why not rethink solving this problem or helping mitigate the problem by addressing alcohol wherever it is sold after 10 p.m. or 10:30 p.m. And that includes restaurants. That would solve the problem of enforcement, law enforcement, if they're thinking, well, I don't know if this business qualifies. If alcohol is banned, then we don't have to worry about that part of enforcement. And I agree, most people are really trying to do the right thing, and including business owners, small business owners, bar owners, restaurant owners. But the mayor mentioned several weeks ago, about this whole concept of squeezing the jello. And if you, tighten restrictions in one place, then people are just going to go do it somewhere else. And that is true, but I don't think that allows us to decide it wasn't a good rule to begin with. I mean, not everyone wears their seatbelts, but we don't say, well, since some people put up a big fuss, maybe we should reconsider people having to wear their seatbelts, as a very, kind of crude analogy. But anyway, those are my thoughts about this regulation.
Comments, questions, discussion?
Just one more thing. In talking about where we're having issues, I want to ask this maybe of Charity. Have we seen any issues coming up from any businesses where they are cluster sites, restaurants, big box stores, any place like that? And just anecdotally, I was told by UTPD that their concern has been basically personal gatherings at non-businesses as being an issue for them. So I just throw that out. But do we have anything that shows we are having an issue? Because a lot of these businesses have remained open even though we have our regulation in force.
So when we look at our cluster data, our most common location in our most common place to have a cluster is a community setting. And Charity, can you off the top of your head remember what the definition of community setting is?
It's kind of the catch-all.
Yeah, educational or religious or a lot of different places. It's not restaurants. It's not necessarily bars are not on here, but it's not restaurants. I'm wondering if bars are thrown into that. But
Bars would be more than likely in the restaurant
Yeah.
category. At this point in time, I should probably turn my camera on, sorry. Dr. O'Brien, we have really the majority of the clusters we're seeing is what you've been hearing related to campus activities and Greek life and that sort of thing. Anecdotally, hearing more information at this point about from the folks at UT that are helping with contact tracing with the students there, and some of their information that activity has picked up in the restaurants and bars in the area. But the identified clusters at this point have been either in houses, off campus houses, or with Greek life at this point.
Charity, could I ask a question about, this is one thing I've never understood about from a contact investigation perspective, is all of those organizations that you just described, and this gets to clusters, people tend to know who was there.
Mhm.
But when you're at a bar,
Yeah,
when
that's
you're at a restaurant, you have no idea who was around you. I mean, that seems fundamentally flawed. Can you really trace clusters back to bars and restaurants like you can to these community gatherings and to frat house parties and all these things where you know who was there?
It's challenging, definitely. So what we have to do on that end, and the way that we track that and work it, is when we interview every case, we ask them all the questions of where you've been, who you're hanging out with, and if or have you gone to any bars or restaurants or whatnot. And we literally at this point are listing them out in our database. And then we have a team, a cluster team that reviews that. And we can sort by facilities and see if we're starting to see trends identified by people that are completely unrelated. That takes a lot of work, and that's going to be a harder way to do it. And again, our information is only as good as what we receive on the front end. But we are working hard, but to get the information, but you are correct that it is, it's more natural and a more easy flow when you've been to a party with people that you know, and that kind of thing. But we are doing our best to look at, and we have in other situations picked up cases or clusters in the method I just described with workplaces and that type of thing. But it's not the most obvious way to identify, definitely.
Sure, and that was in no way intended to be a value judgment on the health department's effectiveness.
Oh, no, but we haven't explained how we do that, so I'm glad that you asked.
Because to me, inherently, it's not going to be the same type of exercise. It's not going to be as effective to try to identify a cluster that came out of a restaurant, or more importantly, a bar where there are a lot of people grouped together. Your party, you're there with 3 people, and there are 5 more parties around you, and you have no idea who those people are. And I bring that up not to necessarily fundamentally direct the conversation. I bring it up because if part of our conclusion is going to be, as we've repeatedly said, and whether they're identified from bars, we need to, I think, recognize that it's just harder to do. It's harder to figure out that there was a cluster in a bar than there was in a backyard barbecue or in one of these other types of community gathering.
That's true. Absolutely true. Just while we're on the subject of bars and closures and restaurants, I do want to take this opportunity. I was going to bring it up in other business, but we seem to be talking about it now. We did have a meeting yesterday with Chancellor Plowman and many others. And one of her asks was to close the bars and restaurants on and around UT, well, not on UT campus because they don't have any, but near the campus. She talked about maybe having a 2-week kind of stand down or, stand back or whatever to coincide with that period. And in talking to my staff and looking at the maps and thinking about that, it's a pretty wide swath of area. And I think it'd be, now Nashville has done this. Nashville has done some geographic closures based on data. I think there are a lot of potential concerns with that. Targeting one geographic area obviously is going to impact those businesses greater extent than other businesses in town. So my staff was concerned about enforcement and compliance, and it's kind of there are lots of little restaurants and bars scattered throughout the fort, and all of those are highly utilized by students. And where would we end that? Where do we draw the line and say, well, students don't go here, because we know students can get in their car and go just about anywhere they want to have a beverage. So I just wanted to bring that up. Chancellor Plowman did ask about doing that, and for this board's consideration, it's really. But I do think that there are lots of businesses that are really trying hard to be compliant, and from some of my staff, concerns about stricter regulation, punishing the good guys who are doing things well and appropriately, and their tables are spaced out. I've been to very few restaurants in town since all this started, but pick and choose the ones that have really good social distancing, and their staff are all in masks, and everybody else can do the same. But so anyway, I just wanted to bring that up for consideration by this board. I don't know the timing of when if they do that, when they would do it, but we do have some examples from Nashville where they had orders to close and associated maps of the city of the areas they were talking about.
Comments about that? Questions? If not, I have a comment about it, Dr. Buchanan, and that is that I think it would be, from a legal standpoint, probably to be considered somewhat discriminatory to look at a tight geographical area and not suspect that those business owners would really protest at that. But in a larger sense, from, again, a public health standpoint, if you have these places outside of walking distance and people start driving with a high degree of intoxication, you can expect DUIs and you can expect accidents and, certainly trauma arising from that to probably go up, which would be a really, unintentional consequence that would have an immediate public health negative value.
So, Dr. Gocher, I have an additional comment and that is that we had Dr. Plowman present to us today. I don't know if you guys watched her briefing yesterday, but there was without question an urgency in her voice about what's going on at the campus in terms of their rate of growth right now. And so the reality is that if they don't get this under control, and I'm taking these cues from her, that they're going to have to take more drastic action. And if that's the case, every one of these businesses that we've just described in this radius, whatever radius that was that you went through, they're all going to suffer consequences because of if UT has to change their approach. And so, what we talked about a few weeks ago, ideally, this would be a partnership. But, and Dr. Gocher, I had your point about people who are still going to, and Dr. Mayor Jacobs' point about they're going to find a way, and maybe they're in a car when they wouldn't have been in a car otherwise. That's a very valid point. But I do also think that if ultimately we choose to do nothing on this topic, then, I guess there is a precedent in Nashville for some sort of geographic precedence. Then if UT doesn't pull it off, and they're not able to turn this around, we're going to have to accept the fact that there wasn't an action we took other than the 10 p.m. curfew, which has been questionable effectiveness, that helped. And it's not, I guess my point in that is it's not just about the university and lecture and all that. It is about those businesses in that radius. They're affected by that. And so, this is truly a rock between a rock and a hard place. But there's on this one, I think there's even an economic, if you're looking at the longer term, there's even an economic argument to be made either way, which is not our role. And I understand that. We're here as a public health board.
So one comment I would have about the input, involvement, and so forth from the University of Tennessee, and I think as a board we'd certainly appreciate Dr. Plowman's or Dr. Gregg's input on this, is that they hold a much more powerful regulatory tool than we do. Because if they wanted to, they could declare all of those facilities or any facility or universities throughout the nation that have gone completely online. There are universities that have just shut everything down, and they're struggling to manage it. But if there are some universities where they have just suspended students and they didn't get a refund on their tuition. It's a very powerful tool, much more powerful than what we have. And if they are really feeling that is something that needs to be done, they could pull that trigger unilaterally because they are the educational institution that the students are going to. Now, they could quit school and still go to the bars, but that's unlikely to happen.
Nevertheless, Chancellor Plowman continues to make the case that they are reaching the limit of what they can do without consequences to the UT community and the larger community. And that's why we invited her to keep us in the loop, so to speak. And that's why we're considering how best to support her and her team in succeeding. It's so interwoven. Sure, she could send everyone home, but that comes at a great cost, not only to UT, but to the immediate businesses in the community. It just does. So there, We are in a very difficult place, all of us, in trying to find that narrow path to keep as many people healthy, as many people out of the hospital, but also keep inching forward and people not have to suffer financial crises. If we don't do anything, the numbers are not going to get better. I mean, that's not an opinion. That's based on the science that we can look in our state, in surrounding states, the country, and the world. So, I agree. We have to decide, are we willing to be proactive or reactive? And it'll have consequences. Either way, I totally appreciate that.
I guess my thinking based on what we've seen so far is that we could even have more stringent regulations. There would be some businesses that would be compliant and would suffer, and there would be many that would go rogue because of really lack of enforcement. And I don't know whether a more stringent rule would in fact affect the numbers much to speak of. Masks are different because they're done population wide, and I think in our attempt to be, using the term surgical, in our attempt to just narrowly affect something, we have a very imprecise tool to do that, and there are economic consequences to it that we all know. It's just that the tool is not precise. And we've seen businesses that either just ignore the law or figure out a way to skirt around it. Gosh, we've discussed that over and over again. It's frustrating, but in the end, I don't know whether this is going to affect the curve or not, because it's different than the mask mandate.
I'm trying to look it up right now, but my understanding is the CDC is reconsidering its recommendations for recognizing bars in general as hotspots. Anyone else familiar with that data or that recent development per the CDC?
I'm not. I think the other thing to keep in mind is that, and in public health, we do this all the time. We are trying to change human behavior. And doing that is really challenging. And will regulation really change human behavior? And I don't know if it will or not. But that's what we're trying to do, because this is not a UT's plan. They have a great plan for what they're doing in class and on campus and in the dorms. So it's human behavior that we're needing to change, and what's the best tool to do that with? And who has it?
So the way I sense it, we're really to a point of, in this discussion, at least what I've heard is there's three options, assuming that, as Dr. O'Brien has mentioned, the 10 p.m. curfew as it stands is not really having a significant impact. What I've heard is there is a conversation, or there's discussion about a geographic closure related to the UT area. A second approach would be, if it was more enforceable, at 10 p.m. stop alcohol sales across the board, meaning restaurants and bars, with the idea that if it was across everything, it would be cleaner and theoretically more enforceable. And the third would be to take essentially no action and educate and recommend. And so I have to kind of move this along. Those are the three that I get out of this conversation. And so, is there anything that I've specifically missed? Or did I mischaracterize anything?
Dr. Shamiyeh, I think you named it perfectly. I think we're just at a point right now that I think facing what is actual in our community, I would love to be proactive. I'm not sure we could get an enforceable, get law enforcement to come on board right now with adding more rules. I hate to say we may have to let things get just a little bit worse before we can get things better in that regard in our community. I just don't think it's going to float real well. I do agree with Dr. Hurt that no alcohol across the board is a more fair thing. That means places can stay open. They could do what they want to do. They're just not serving alcohol. The problem is we're already have documented from me talking to law enforcement that places that we're talking about that affect these students are staying open, but it doesn't appear again that those are the primary drivers of increased cases. It's more the Greek life, getting together at somebody's house in the fort, that sort of thing. So education, using the power of the university is going to probably affect this concern more than anything right now. So I think what may have to happen is we let this regulation close out tonight, and then we could prepare something that may be an alcohol-free time period for everybody, and have that held if we see the numbers continue to grow, and to see if we have cases arising from some sort of spread from bars and restaurants.
So guys, remind me, does it close out tonight?
No, it's next week.
Next week?
Yes.
Sorry, I thought it was tonight. I apologize.
So we're still in the category of general discussion on this, and there's no specific action that needs to be taken, although I guess it could. So several of us have been discussing this. Mayor Jacobs, could you give us your take on the success or lack of success of this and economic implications, and just your thoughts on it? We would really appreciate your comments.
Well, thank you, Dr. Gocher. From the enforcement standpoint, if we're looking specifically at the Strip, in general, as professional courtesy, the Knox County Sheriff's Office, as I understand it, they have jurisdiction over the entire county, but as professional courtesy, those things are enforced by KPD. So I can't speak to that enforcement part of it. So I'm not I talk to the sheriff much more regularly than I do KPD. I would also like to point out that the sheriff is actually also, earlier I called it the sheriff's department. It's the sheriff's office. So the sheriff is an independently constitutionally elected officer. So he is independent of my office. So when it comes to enforcement matters for anything, you'd actually have to specifically talk to him. As Dr. Buchanan said, the next step would be to have the health department enforce this, which is problematic on a number of fronts. First of all, manpower. And second of all, they're not, I really am uncomfortable with folks from the health department going out and serving summons and that sort of thing. So it is a very difficult question. And you're right about the economics. I mean, if something happens and UT has to do whatever, those businesses are going to suffer. They're going to suffer if this board decides to take more strict action. When we look at the compliance, I think that Dr. O'Brien hit it right on the head. There's some things that people are going to just naturally comply with much more easily than other things. And in many cases, you just can't get them to do it. I mean, that's just a fact. So unless you want to become extremely draconian, which might backfire, and people would actually engage in the behavior you don't want them to because you're pushing them so far. And something else that I worry about is the relationship with the community at large. In this case, if you were to do a bar closure or a restaurant closure around specific that geographical area, I worry about the relationship between the community at large and the University of Tennessee, because the community is going to be thinking, we've done all these things, and this is happening because of the students at UT, whether that's fair or not. That would be the public perception. And I don't want to say, I would be less uncomfortable with UT taking actions that would economically impact those businesses than I would this body. Because as you said, that's under the University of Tennessee's purview. But if this body does it, you have to understand that say you implement a 2-week closure or whatever, a lot of businesses are just barely hanging on at this point. We don't know if there's any more money coming from the federal government, the PPP money. People will lose their jobs and they'll lose their businesses. And they're going to look for someone to blame. So I think when you look at all those things, I agree with Dr. O'Brien that, you know, really, and you, Dr. Goetze, that we really need to encourage folks through education. But if there's anything more strict put on the table, I think that potentially could backfire and you could actually see things become worse in that area.
Could Mayor Jacobs and Dr. Goetze, I think one thing I didn't really understand was, I understand the university has it within their power, if you will, to, you know, say everything goes online or whatever. But if I heard you correctly, you said they can take specific action related to specific businesses, for example. And I don't know if that's in their code of conduct. Maybe I misunderstood, or maybe I just didn't understand. So could one of you explain that to me?
And I'm certainly not an expert, but yes, they have more flexibility because they have a code of conduct, because they have on the rules for their students that in order to, I guess, get compliance out of their students. Again, I'm not an expert, but we have seen universities around the country take action, extraordinary action in many cases of saying leave campus, because the kids can't, I shouldn't say kids, the students can't do this and can't do that. As of course, as the county, we can't do that, but I believe they have more flexibility in order to, with their own student body, to do those things.
Dr. Shamiyeh, it's my understanding that the use of the UT Code of Conduct is that weapon or tool. And when we first discussed UT's role in sort of helping out with this, it had to do first with campus affiliated organizations. For example, any organization, but especially the fraternity and sorority system. And my understanding in talking with Dr. Plowman's chief of staff some time ago was that if it were a university sponsored organization, whether their activities were on campus or off campus, that they were under control of university regulations. But with the code of conduct, it empowers them to act against any student that is violating the code of conduct. And the point of the code of conduct is safety of the student body. And so if there are persons or groups of persons that are not university associated with their parties and they're outside of the system, but it can be shown that they're contributing to lack of safety of the larger student body by bringing back an infectious disease process, they can be suspended. There's a variety of measures that can be taken against those folks. And you know that's kind of what I guess I was parenthetically referring to, is that's a very surgical approach, in that if there's a group of students that are completely out of control, those students could be reprimanded to the point of being suspended and losing their tuition, which is a huge fine, if you want to call it that.
I believe that Chancellor Plowman is exercising those authorities in select cases. So I'm aware of at least 2 instances where she has done that.
I actually think there are at least four as of last week. But again, her ability to enforce the code of conduct is limited off campus. Yes, it does extend to Greek life, but that's it. So students living off campus, she has no authority.
Well,
and that's why she keeps asking us for support. I'm not suggesting in any way that I personally see too many legal problems and not even an effective solution to closing businesses in a specific geographical area. But nevertheless, even if we don't do that, a small city state of 30,000 students needs to be considered in how we continue to try to mitigate cases. And again, although we've not been able to directly link clusters to bars, we've already talked about and addressed the fact of why that might be, that might be an actually much more difficult cluster type of cluster to identify, but that doesn't mean it's not there. My thoughts.
This might be completely irrelevant to this conversation, but the legal drinking age is 21. So when we're talking about college kids at bars, I mean, I think that's something to consider too, is how, and I know we've seen the pictures of a bunch of kids at bars, but that's just something to throw out there too. You know, how many actually students and are we talking about, and that sort of thing.
Well, we hear in our emails, we hear from bar owners and restaurant owners telling us there are lots and lots of students now that the campus is open again, and there are lots of students showing up.
So let me ask this. This is maybe a different idea about how to approach this, but and I don't know if this helps UT with their code of conduct or not. But guys, we had a lot of conversation a few weeks ago, even a resolution that was ready related to gathering size. But the idea was it got a lot of attention in part because it was going to be binding, I think. But I mean, right now the gathering size recommendation is 50, which I've never felt comfortable with in this, because the more people you get, the less likely the 5 core actions could be followed. I would be comfortable, and not just for UT, but across the community, with a non-binding recommendation that the gathering size in 1,000 square feet, whatever, go to 25 or even 10 indoors. And again, non-binding, but it would be up to the university. I mean, it would be the recommendation of the Board of Health. And I don't know if it would be up to Chancellor Plowman and the university to decide whether they wanted to use that recommendation from the Board of Health in part of how they enforce their code of conduct. But that would be a little more of a shift. It was notable to me how much time we spent on that, but because we were so focused on that it was going to be binding and was it time, we never made a recommendation of 25, which I think would have not been a bad thing to do, even in a non-binding sense. So if we feel and again, I don't mean to totally, we can immediately go back to the conversation about what to do about alcohol sales in bars. I'm fine with that, but it's just another idea about how we could approach this in a non-binding manner, but send our recommendation, send our message if it would help the university.
Other points of discussion?
I just want to point out that the less than 25 people per 900 square feet is the 6-foot distance rule. That's how that pans out.
Do we want to talk about making a change tonight? Just bring it up, I'm not making a motion at this point, to drop this one regulation we have for curfew and work on a change to where we make a recommendation on 25 or less in 900 square feet, again, as recommendation, and maybe have that ready for presentation next week. We can leave what we have enforced, but nobody's enforcing it. And, it's going to die if we don't act on it next week, but I didn't know if we wanted to bring it up and just see if there's any thoughts on that at this point.
Let me ask a point of, Mr. Sanders, if we got to the point of a recommendation that is not a binding action, does the amount of prep work that has to go into that, is it the same with multiple whereases and then the action that follows, or is it possible for the board to simply vote that this is what we recommend and not have that week of detail work and all of that stuff?
Dr. Shamiyeh, so under new business, any member could simply move that this is the sense of the board. This is a recommendation of the board. And that's it. You don't need any document at all. If you want a resolution, we'd have to draft it, but that would be less prep work than one of these regulations, because it's, again, simply your sense. It's not, you're not trying to enforce it, and we don't have to defend it in court, honestly. So a resolution would be quite easy to draft by next week. I don't have one ready for you tonight, but you can certainly, under new business tonight, simply recommend that people do this. If you get a majority vote, that's fine.
And then follow it with if we wanted to follow it with a non-binding resolution the following week to make it a little more formal.
Sure.
Thank
So,
you.
Dr. Shamiyeh, to add to that discussion, you know, and I know you're aware of this, but the CDC does not have any specific number recommendations because it's multifactorial. We discussed this before, but it has to do with the square footage of the area. It has to do with mask versus no masks, you know, all those factors. So if we do have a number, be it 25, be it 50, whatever that number might be, I think as Dr. Hurt was pointing out, that it needs to be coupled with indoor versus outdoor square footage, mask, no mask, all that sort of stuff, because that takes into account all those factors, because the CDC, again, does not address the specific number.
Understood.
So is there any interest in pursuing a motion and a second to what Dr. O'Brien talked about, or shall we continue until next week when this resolution sunsets? And that's either for discussion or a motion and a second. Anything that you would like to do would work here.
I'd like to make a motion that we table proposal 2020-4 and 2020-5.
Well, one question, because 2020-5 is not in force. That was a proposal. So I will second you on 2020-4 that we rescind at this time.
I agree with that.
So the motion is to rescind 2020-4, and I have a second. Discussion.
It'll be clear with my vote, but I'd be more inclined, Dr. O'Brien, I don't disagree with your point, but I'd be more inclined just to let it play out to its expired date, because there still is going to be there'll be some after meeting thought, even if we do have any other recommendations or action about whether, you know, what else could be done. So my bias is just to let it play out for one more week.
So
I agree. I agree.
I guess question to Mayor Jacobs, is there going to be any significant difference between rescinding that order now and rescinding it in 1 week, in your opinion?
I think the difference is if, as Dr. O'Brien pointed out, if people aren't complying with it, it's not enforceable. I would just go ahead and do it now, frankly.
I mean, I have gotten feedback that that generally speaking, the amount of activity on the strip is less this year than it has been in prior years. And I mean, guys, anything to give them any relief for another week. That's just why we're not forced to act on this tonight. And if we're resigned to the fact that it's just not being followed, then it can just not be followed for another week. I mean, that'd be my take.
I would like to say my thoughts also are that not everyone is following the mask regulation, and we are not obsessing about not being able to enforce it. What are our rights? Let's just throw the baby out with the bathwater if we can't get 100% people on board. And we know not everyone is going to comply with every regulation. Smoking in restaurants, or not smoking, not, having to wear your seatbelt, putting your child in their car seat. Not everyone is going to adhere to any kind of regulation or law. That doesn't, to me, indicate that the law shouldn't exist or the regulation shouldn't exist. So, maybe not everyone's maybe not all bars or restaurants are going to follow the regulation or adhere to it. But I think most people are really trying, and they'll tell us that in their emails and in their feedback. And if we go to these places, these businesses, we can see people wearing their masks. I don't frequent bars, but my understanding is most bars bar owners are trying to do the right thing. Saying that if we can't get them all to comply, and therefore shouldn't at least try to implement something that we believe works based on the science. And I pulled up the CDC site. It's very easy to find the recommendations about bars and restaurants. And of course, socially distanced seating is much better than not in terms of restaurant and bars. The longer people are together, without observing the 5 core actions, the higher the risk of them becoming ill and or increasing illness within the community and hospitalizations.
I think there is one other thing to consider here too, when we are talking about human behavior. If we're talking about non-compliance, so you basically have the folks that don't care and are letting people do anything after 10 o'clock. Everybody's going there. If you take this off tonight, the people that are doing the good work and are trying to do good things in the restaurant, it allows them for some of those people to come in after 10 o'clock. So it might actually help as far as the spread of this goes, because you have more responsible business owners. You take the handcuffs off what they're able to do.
Any other discussion?
Does the Tennessee Pledge, which remember, we default to the Tennessee Pledge. That was always the idea, where we haven't done anything specific. But I recall there being something about in bars, people being seated at tables. Now, again, Tennessee Pledge is not a binding document, as I understand it. But does anybody know, Dr. Buchanan, do you know? I mean, because that's the other part of this is, again, if we're going to go on everybody's going to do the right thing, do we need to re-communicate the expectations to bars about what this should look like?
Correct me if I'm wrong, but I think that didn't we get like I won't call it a cheat sheet, but it was kind of a fact sheet of our regulations, the Tennessee Pledge, and what that involved.
I typed that up, but it was really with a different purpose in mind for in new business. But it does kind of go through. I did pull some things out from the Tennessee Pledge. It's so complicated. I just wanted to see if anybody else would be able to agree or refute. But if you want, I
really appreciate that. That was the first time I'd seen that. That was.
Yeah, I mean, it helps this discussion. It's nothing really earth-shattering, I guess, as long as it's not inappropriate to show it now. We could show it.
May I speak about the Tennessee Pledge? Tennessee Pledge states that you cannot stand. You can't stand at a bar. You can have table service in a bar. You can't serve at a bar. The bar is open to provide service to patrons at tables, but not at the bar itself. And so that's that. Most places are compliant with that. Some places are not, but most places are compliant with that. And so, I hear from my staff, the outliers are the ones that people complain about and we see, but there are thousands and thousands of restaurants in Knoxville, and most of them are being compliant with these guidelines with the Tennessee Pledge. The restaurant guidance from the Tennessee Pledge is actually one of the easier ones to follow. I don't disagree that the Tennessee Pledge can be a little bit confusing, but
that's our expectation then. I mean,
Only seated.
The pledge is more of a highly recommended document, right?
Yes, the Tennessee Pledge is a guidance document to provide guidance for businesses to be able to reopen safely.
So I bring it up because wherever we go with this, again, if we're shifting philosophically at some level, maybe tonight, maybe some other time, to more of an advice, we're going to make recommendations, we're going to give guidance. Let's at least reiterate what are the things that are in print that we're following that are supposed to be. And if they were really all precisely following that, I would feel better about it than I have in the past.
So, I'm trying to remember, Dr. O'Brien, you were the one that offered this resolution, and it had a second.
Dr. Drake first, and I seconded her actually.
Okay, Dr. Drake. Okay, Dr. Drake. So, Dr. Drake, in your resolution, was there a comment about Tennessee Pledge? If not, perhaps you would accept that as a friendly amendment.
I would. I did not mention Tennessee Pledge, but I would like for that to be inserted in there.
Well, one thing we're doing is we're rescinding a public health resolution. So we're not proposing a new document. We are rescinding an order in place. So I think that would follow as a separate issue. So we're just getting rid of something if this vote goes that way.
Okay. So other discussion on the vote to rescind 2020-4. Questions, discussion? Hearing none, since we're ready to vote, are we ready to vote? So Dr. Buchanan, if you will call on the motion or the motion right to rescind 2020-4.
Dr. Drake,
Yes.
Dr. Gocher,
Yes.
Dr. Hurt,
No.
sorry. Mayor Jacobs.
Yes.
All right, I'm at the computer.
I'm writing it down.
Thank you. There we go. Apologize. Dr. O'Brien,
Yes.
Dr. Shamiyeh,
No.
Dr. Souza is not here. Ms. Wagner?
No.
So we have 3 no votes and 4 yes votes. So 2020-4 is rescinded 4-3.
If I could interject here, the board needs, for affirmative votes, the board needs a majority of the membership voting affirmatively. This board has 9 members, and therefore you need 5 affirmative votes to take an action.
Oh, well, thank you. So the motion fails. Is that correct, Mr. Sanders?
That's correct. Motion fails.
So to be continued next week as the motion expires. And thanks everybody for your patience in working through that. Any discussion on 2020-5? 2020-5 sort of falls from 2020-4, so we may have discussed it. Any further discussion on 2020-5?
I believe before we can have a discussion, we probably need a motion and a second on the floor.
So it's been proposed. Do we have a motion or a second for 2020-5?
Do you need to see it? No, okay.
So I'll move for purposes of discussion, motion.
Do we have a second?
I'll second.
So we have a motion and a second for enactment of Regulation 2020-5 curfew regarding the sale or consumption of alcoholic beverage in certain establishments. So the floor is open for discussion on this.
Just to note, it actually replaces 2020-4 if it passes.
So question to Mr. Sanders, if this were to pass, is the expiration date on 2020-5 the same as 2020-4?
You can make the expiration date whatever you want. I believe the draft of 2020-5 presumes that you wanted it in effect for a few weeks. And so right now it reads, it shall be in effect until September 24, 2020, and maybe extended. But that doesn't mean that that's what you have to adopt. If you adopt it, you can insert whatever date you want. But you need to amend what has now been moved.
So to be clear, if we were to adopt 2020-5, it would extend functionally the 2020-4 regulations until September the
24th, unless you amended it before you voted on it. Right now, that's just it's simply the proposed. It's a proposed regulation. It's been moved, and I suppose seconded, and you're at the point of discussing it. You can alter any of its terms or not, but the proposed date that's written in the draft is September 24th. So someone would need to do something in order to change that.
So Dr. Gotcher, we're at the point of discussion at this point.
We're in discussion on adoption of 2020-5, which is the curfew regarding sale or consumption of alcoholic beverage in certain establishments. And this is to kind of review, this is the one that Mr. Sanders has been working in crafting regarding brown bagging.
So,
but also encompasses 2020-4.
Right. And so this is not intended to be quite yet a formal motion, but given the nature and the extent of the discussion that we just had, as well as the outcome of the vote, on one hand, also on the other hand, knowing that this was close to making it to a vote last week, other than needing wording, I think it would be very reasonable to adjust the expiration date. I mean, you know, we just had the discussion about whether it was going to, the 2020-4 was going to go one more week. We could make this one expire in 1 week for the purposes of conceptually getting to the vote and not get all hung up in the 1 week, 2 week thing. And then clearly we're going to be having to, you know, address that again next week, because now we've got two things that were, one that's just gotten passed, another that is potentially going to expire with that are somewhat different. But again, for the purposes of tonight, I almost would just recommend we change the date to 1 week so we can even get this to the point of a vote. And then depending on the outcome of that vote, we figure it out again next week.
So, Mr. Sanders, would this be something on the order of a friendly amendment, or is this an amendment that we need to discuss and vote on prior to plugging it into 2024 if we decide to accept that amendment?
I think that's up to the original movement. If the original movement considers it a friendly amendment and the person who seconded it has no objection, then it can be considered a friendly amendment.
Dr. Drake, thoughts?
Well, I don't know why we are, extending it till next week.
Yep.
I'm not really for it.
Maybe I didn't articulate that well. I think right now, as it's written, if it was passed, it would expire in 2 weeks. Is that right, Mr. Sanders? As it's written?
I'm not counting weeks right now, but it would take effect, as I recall, I believe September 11th, and it expires on September 24th, according to the document in front of us.
All I was proposing was to have it expire on the same day that 2020-4 would have expired, which then would not negate the discussion we just had and the vote we just had about 2020-4. I'm not saying to defer the conversation the next week. I'm saying to align the expiration.
One thing that would be of concern is education of those additional establishments would have to occur. And to do something for 1 week, I don't know how productive that is. I'll just throw that out there because it's going to take time to get the word out to who's added in the mix. So a 1 week, not even a whole week, basically, because it's going to start on Friday and we're going to look at it next Wednesday. I think we need to think about that.
Well, I think we're in the danger of the intent, and again, not knowing how the vote's going to go. I'm just trying to give this its fair shake. The intent of what conceptually is going to just get caught up in a deadline issue, which I don't think is fair to necessarily to the effort that went into the resolution to begin with. Because the thing is, there's two things that are bunched together here, and that's what we're trying to navigate.
So we have the original resolution for 2020-5 unamended at this point, and without a friendly amendment, and we have a second for that. So we need discussion on 2020-5 as it stands, or if there is no further discussion, we can vote up or down on that.
Technical question, I guess, Mr. Sanders. So if Dr. Hurt, as the seconder, wanted to change that as a friendly amendment, then she could, because since Dr. Shamiyeh was the proposer. Is that right?
I've lost track of who originally moved and who seconded because Dr. Guncher had asked Dr. Drake about it after I mentioned the friendly amendment. But
Dr. Drake,
Dr. Shamiyeh and Dr. Hurt in that order.
so both of them need to consider it a friendly amendment for it to be a friendly amendment. Does that make sense?
Because yes, Dr. Souza originally introduced it last week, but she's not here this week, I believe. And so I did give the motion. And so I don't know what that means is not my ability to, somebody just tell me what the rules are.
You can, yeah, so if you want to make that as a friendly amendment, you made the motion, so you can make the amendment, and then your seconder, Dr. Hurt, has to agree. It's amended, and right, correct, Mr. Sanders?
You're right, yes, and that should be it. If either of you disagree, then you actually have to have a procedural vote on the amendment because the motion belongs to the body at this point.
so it looks like if everybody that brought the motion and seconded agrees as friendly amendment, we now are discussing 2020-5 as amended to have a deadline of 1 week. Discussion.
So before we get to the point of amendment, is there, Mr. Sanders, is there a way to actually break out the language simply to make this a standalone and not a document that replaces 2020-4?
Not easily. The document, what this document does is adds to the 2020-4, which is the sale of alcohol in certain establishments, essentially what you all term bars, which are establishments that derive 50% or more of their gross revenue from the sale of alcohol. The problem you faced was that there were establishments that were at which people drank, perhaps excessively, but did not sell any alcohol and therefore were not subject to the 2020-4. So what this proposed resolution does is fix that problem by extending 2020-4 to 2020 to entities that don't sell alcohol but permit the consumption on the premises. Now, the answer to your question, of course, is yes, it can be written so that it only applies to those entities and not to ones that sell. That would take a little bit of revision, probably more than I can do while you're live here, but yes, it can be done.
Further discussion on 2020-5 amended.
Yes, this is Maria Hurt. This may be a question that Dr. Buchanan and her team can answer. It's related to Dr. O'Brien's concern that it'd be very too narrow a window to reach the specific businesses that this specific regulation addresses. It was my understanding that there are actually a handful of businesses that this new definition of establishment includes. Can you give us a sense of how many establishments this might actually impact? Because I'm thinking if it's not in the dozens, perhaps it's not unreasonable to think that, a short-term education, giving these folks a heads up is not unreasonable expectation.
The estimate from my staff is there are about 5 to 6 of these in the county. We do not have an existing regulatory relationship with these establishments. So that changes the dynamic a little bit for my staff. It's a what you call in the sales business a cold call. So that's a little bit different for us. Certainly they would do their best to educate within a week, but I agree. I mean, putting something in place for a week and potentially letting it expire, I just worry about the whiplash and the inconsistency that demonstrates and trust from the community. That we just put it in place for a week and then we rescind it next week. I'm not sure that the appearance of that to the community, I'm not sure how positive that would be. That's just my perspective.
So I think that maybe the lesson here is to not stack. The more we pull together, the more we wind together, the harder it is to unwind. And so, with that being said, I do not intend, even if I'm able to have a friendly amendment.
Dr. Gulcher, this is Diana Drake. I have to leave. I'm sorry.
Shall we take this to a vote before you leave, or shall we discuss more?
Can I call the question, Mr. Sanders?
Sure.
Yeah, I call the question, please.
So we wish to vote immediately. Do we need a majority to say we're going to vote immediately, Mr. Sanders? I think so. Everybody in agreement with that?
Wait, Mr. Sanders, you're muted. You're muted, Mr. Sanders.
Sorry. Yes, you do need a majority to accept calling the question, but yes, go ahead.
So, Dr. Buchanan, you want to run through it real quickly as a roll call, and then we can vote immediately. Sorry for the
Okay,
slight.
so roll call for call the question.
Yep.
Is that what you're asking for? Thank you. Dr. Drake.
Yes.
Dr. Gulcher.
Yes.
Dr. Hurt.
I'm sorry, I need clarification. What are we voting on?
To vote immediately?
Voting on call the question.
Voting on whether to vote?
Yes.
Okay. Yes.
It's been discussion, vote immediately.
Dr. Jacobs.
Dr. Jacobs, thank you. Yes.
Dr. O'Brien.
Yes.
Dr. Shamiyeh.
Yes.
Dr. Souza's not here. Ms. Wagner.
Yes.
Unanimous to go ahead and vote on Regulation 2020-5 as amended, because you did correct, Mr. Sanders, the amendment.
I believe I heard Dr. Shamiyeh say that he withdrew his permission to amend.
That's right.
Okay.
So we're voting on Regulation 2020-5 as originally printed, and a vote in the affirmative is, of course, to vote for it, negative against. And we need a roll call vote.
Yes, Dr.
And
Drake.
Lead us on.
May I go? Dr. Drake.
No.
Dr. Gocher,
No.
Dr. Hurt,
Yes.
Mayor Jacobs,
No.
Dr. Shamiyeh.
Yes.
Sorry, Dr. O'Brien. My bad. Dr. O'Brien,
No.
Dr. Shamiyeh,
Yes.
Susan's not here. Wagner.
Yes.
Okay, we have, once again, 3 to 4.
So again, because a majority of the board did not pass the resolution or the regulation in this case, the vote would fail. Sorry for stepping on you there, but
No problem. No problem. So next item in the agenda, if there's no other discussion on that, is the proposed Knox County Board of Health rules. And you should have had those distributed to you as a proposed document. And hopefully everybody's had time to kind of look over those. So we can do this in one of two ways. We can have some general discussion and then vote or have a motion for approval in a second, or we can go directly to a motion for approval in a second.
As I work with Mr. Sanders on this, there's one question that he brought up to me that we may need to do a friendly amendment for if we get to that. Is it okay if I just bring that up for information first?
Sure, we can have general discussion first and then go to
I believe Mr. Sanders said we do not have a specific location noted in the document as a home for the Board of Health. It just says the city county building, and it was recommended that we actually list a location within the building. I believe he said the small assembly room. Is that correct, Mr. Sanders?
yeah, that's right. The advantage of actually stating the location that the board meets is that you then put the public on notice as far as when and where those meetings will be, which is not to say you shouldn't public notice the meetings anyway when they occur. But as far as whatever the meetings are that are actually in your rules, the public is on notice that that's where they're going to be and that's when they're going to be. And specifically, we had just worked on the language and considered the first Wednesday of every third month as the meeting date and time, along with 5 p.m. But the location would be, you need a place that's accessible to CCTV, you need a place that's secure, you need a place that's big enough to hold people. The large assembly room on Wednesday nights is taken by the school board. So the small assembly room is what I thought would be a reasonable alternative. There's nothing magical about that other than it meets those criteria. If you have another location that meets those criteria, you're welcome to use it.
So I think my staff just checked and the small assembly room is not consistently available on Wednesday nights at 5 p.m.
Well, we're looking in the rules for once every 3 months as the standard regular meetings. Do we think we could even put it in there to state that or not?
I think that one of the challenges is that, again, my staff, who is not necessarily the board support staff, is going to have to arrange that and look at that. So I just don't know what's in there, to be honest. If it's available with that regularity, I can't answer that question.
So Dr. Buchanan, we have, when we were in more of an advisory capacity, had our meetings in the room that you're in right now. I think that's the room. Is that room capable of fulfilling our legal obligations in terms of community TV and necessary space? Does it work, or do we need another place?
No, it doesn't work because of public forum mostly, partly.
Okay.
Mr. Sanders, could we just leave it as is and just state city county building and then name a room based on our published agenda?
You can, and right now there's just a blank line. It doesn't even say city county building. It just says in/at or in or at the blank. And you could eliminate that altogether. One thing I will note for several of these issues that you may be discussing, right now you're discussing this without a motion.
Right.
So there's not even a friendly amendment needed.
Well, actually, what's in the, well, I'll make a motion just a second, but it is in the version that's in the agenda. So it says the board shall meet in the city county building.
I apologize. I must have an earlier version in front of me.
So this was just taken basically from the county commission, honed down to what we do, minimized, and it basically sets one thing, which is a public forum will be held at least once a month. Or if we have meetings every 2 months, every 3 months, we will have a public forum offered. Less than that, if we have 4 meetings a month, one of those meetings will have a public forum. So that's the one thing that's a little different in here, and it's elucidated, and it's for 30 minutes, 3-minute speaking periods. So everything else is just, regular rules. So I'm going to make a motion to accept the proposed Board of Health rules as written.
So we have a motion. Is there a second?
I'd like to discuss it some more.
Well, we
before
need
make
to.
a motion to vote
We
on it.
need to have a second to discuss it more.
Discuss it.
I'll second.
So we have a motion and a second discussion. Go ahead, Dr. Hurd.
Well, so I compared it to the county commission just to make sure I really understood what we were trying to achieve here. I want to say the copy I have in front of me of the county commission says it's simply they're going to meet at the city county building. So they're not specific that I can find about a specific room. So I'm not sure that we need to, that needs to be the top priority, because we know that whatever we decide in terms of logistics is available for us and for the community when we return to, in-person, face-to-face meetings. We know that's going to be part of the public announcement. But I also, so I don't know if anyone else wants to talk about that issue specifically, but I also found some differences, and I would, I really appreciate you, Dr. O'Brien, and you, Mr. Sanders, on working on this, but I have some questions about some differences between the set of rules and the county commission's rules that, of course, these were based on, if I may.
Well, the way I look at it is these rules are our rules. We use that as just a template. I try to hone this down to what's useful for us. So there are certain things in the agenda of the county commission we're not listing.
Sure.
We're basically following Robert's rules, trying to condense it down to something simple. So I wouldn't say we are, say we're going to do what the county commission does. We're just using that as our basic foundation.
That's our basic.
Get this down to what can allow us to legally move forward. And that's all it is.
So, Mr. Sanders, if I recall correctly, these previous discussions, if we do nothing, we default to county commission's rules. If we elect to have our own rules, they're whatever we decide as a group by majority.
In essence, I mean, obviously you could go outside the bounds of the law if you really tried, but there's nothing in these proposals that gives me any heartburn.
So we use these as guidance, but we're not bound by county commission rules, but they're a good place to start in terms of guidelines. Sure.
Point of order, I believe Dr. Hurd had the floor.
Yeah, I have actually a few questions, if you all would just bear with me.
No.
Is that okay?
Sure, continue, please.
Okay. Under section D, under speaking, and if you'll just help me understand why this part, why we didn't include no other member may speak longer than 5 minutes on the same subject in the first speech and 3 minutes in any succeeding speech. I understand that's Robert rules, but is there a reason why we did not include that when comparing it to the baseline? I get it. We're not saying we have to adopt the county commission rules, but it's a place to start. I'm wondering if you all could shed some light on why that particular rules, Robert's rules, are not included.
Again, simplification, not putting discrete limits on us. That's all, nothing more.
Thoughts, anyone? Another question, sections P, R, in terms of suspending the rules, Robert's rules, we have a simple majority in here versus 2/3 majority. Again, I'm just wanting clarification.
Same sort of thing, simple majority, the majority of the board. There's no magic there. We can put whatever number we want on it. It was going with what may be the easiest way of doing it. Another way to do it is always, we could reset it. But the problem with this is if we reset to the number, a majority of the 9 members, always the 9, then if we have somebody out sick or gone, we may not be able to pass certain things or do certain things. So this was set up as a way to allow us to keep working with just simple majority at that time. That's all. Nothing fancy.
Thank you.
If I could interject there, you're dealing with section P, correct? P as in Papa?
Yes.
Right. The rule, the proposed rule in front of you says by simple majority of the membership of the board. So Dr. O'Brien, I think that would mean a majority of the membership, not a majority of the voting members present. I believe what Dr. Hurt was asking about is why not a super majority.
Okay, I stand corrected, but that's fine with me too. I have no issue with us always having to go with a majority, simple majority of the 9. That's not an issue to me.
One last question. Thank you for bearing with me. If you will scroll a little backwards to section O, public forum. Something that caught my attention. So this very first sentence here, which is rather long, the board provides public opportunity at board meetings at least once monthly, et cetera, to address matters relevant to the duties and responsibilities of the board, to the board. It doesn't include the county commission phrase to address each agenda item during the Board of Health discussion or consideration of agenda items. And so to me, those are two very different things. Like, people come to voice their opinion, their perspective about agenda items, things that are on the agenda. That's what the county commission, how they operate. But this is saying that people, it's very narrow about addressing matters relevant to our duties and responsibilities. If you could help me understand why that was chosen and not the broader issue of people coming to address what's on the agenda.
I think there's meant as a more broad definition. Actually, we're not limiting the public to our agenda. So we're just saying we're providing the public the opportunity, from 1 month to once every 3 months, whatever our timing is, to address matters relevant to the duties and responsibilities of the board. That's up to the public. That's their perception. So I look at this as a broad description and not a narrow one based just on an agenda. So we get people in the public, like the nice lady who told us about the library. That was not an agenda item. That was public information. It's good to know. So that's my interpretation. And I think, is that correct, Mr. Sanders? Is that how we kind of look at that?
Well, the policy matters are beyond my scope. That you drafted it, and I'll assume that you can explain why you did. I will say, however, that the one phrase that got left out of from the county commission's meeting, the county commission permits people to speak as an issue comes up during the agenda. That is, you're considering a particular item, and they'll let members of the public speak at that time to that agenda item. And since these proposed rules truncate the public forum to 1/2 hour at the beginning of the meeting, it's apparent that that is not something you wanted in the rules for this body.
And that's correct. I'll be honest, my reasoning is, unlike county commission, we are more inclined to look at the science and the information of the statistics and the data. We want public information. but we don't want it to intrude, in some cases could be intrusive, into the work of the board so that the meetings get out of hand. So this is where we have it limited for a 30-minute period, whatever people want to talk about, 10 people, 3 minutes each. We're going to let them do that and take that as information for us. But to make it like the county commission where we have it before the meeting, we have it during the meeting or after the meeting. My personal feeling was that was not necessarily what we as the Board of Health would want to go forward with. And one thing I just noticed, we didn't change something that was in here. It does say large assembly room, and that would need to be changed, and just strike where specifically, right in S, number 1. So it would need to just be in the city county building of Knox County.
Right, that's where I was speaking of the blank space. My copy has a blank space. Somehow I must have sent an earlier version of this to the folks over at the Board of Health to put on the agenda, but that change needs to be made. Or if you don't have a room, just omit enough words to make that flow without a location altogether.
Yeah, I would just say in the city county building of Knox County. That way the room will be determined per meeting. Is that okay with you, Mr. Mayor, as the seconder?
Yes.
Dr. Hurd, have we addressed your issues? Do you have additional topics that you wanted to go over?
Take off in the large assembly room.
I know that, but
I did not know.
Dr. Hurd, are you
I-
your questions?
I had my questions answered. Thank you.
Okay.
Thank you for the clarification, gentlemen.
On page, I have a few things to discuss. On page 7, section N, agenda, board members having to have their items to be submitted to my staff by 3 p.m. on Monday to get the agenda out by 5 p.m. That's not enough time for us to be able to do that. It's not as simple as just pushing a button. So I would ask that we change 3 p.m. to 10 a.m. or at the very latest noon that day. I realize with our very tight meeting schedule right now, that's a big deal. But, and also I would also even add, if we're only meeting quarterly, couldn't we get these things in earlier than that? I mean, this looks like it's based on what we're doing now. And again, we don't want to write rules based on what we're doing now, because this is not going to be hopefully not going to be our standing operating procedure forever. So is it too much of an expectation? I realize we'd have to make an adjustment to this rule for now to even consider that things get in a week ahead of time, so people have time to read them.
And Dr. Buchanan, if I could offer one suggestion to you, with your permission.
Sure.
And further consideration, as I look at these drafts, there are provisions elsewhere in the rules that allow the board to set a meeting date other than Wednesday night, and for the chair to call a special meeting if necessary. It might be better to simply state in subpart 3 of that section in, have a 48-hour prior to the meeting requirement for publication of the agenda, and then you can back up the amount of time your staff needs to put it all together by however much you want. But rather than saying on the Monday, you could theoretically have an emergency meeting on a Sunday, but you'd have to have the agenda published the Monday before that, which might not make a lot of sense. So I'd suggest a 48-hour requirement for the publication of the agenda, and then however much more time you all think you need to put it together for getting material to you.
And I take all that as a friendly amendment. I mean, we can change number 3's wording to 5 p.m., 48 hours before the board meeting. And then Dr. Buchanan, you name what you want in one, and that can always be changed based on needs of the board. But what would you recommend there? We'll take it. I'll take it.
I apologize, I'm just thinking about that, because I don't do that part, so.
Well, I mean, you said something, it would be, normally you'd like a week. You want to say 1 week preceding a regularly scheduled quarterly meeting.
Yeah, I mean, a
Shorter
week,
than 48 hours.
by a week before a regularly scheduled meeting, or within 48 hours of a called meeting.
You'll need to phrase that slightly differently. A called meeting would be what the board chair does on an emergency basis. A regular meeting, these are regular meetings that you're having, but these aren't the regularly scheduled quarterly meetings.
Mr. Sanders, since we can amend this, and Dr. Buchanan as well, just would it be better tonight to just go ahead and say the 48 hours beforehand with the expectation that when things slow back down, we go back and amend this?
That's up to you all, Mayor.
Dr. B, what do you think about that?
I think that's fine. I think we do need to change the 3 p.m. on the Monday before the meeting to something earlier in the day, noon, if that's acceptable to the board.
I think that's a friendly amendment.
Okay.
If you make it relative to the time when the agenda is published, then you won't have to worry about, again, your Monday issue or specific timings. If the board calls a meeting at, noon on Tuesday, you have a publication requirement of 48 hours prior, and then you could simply make agenda items due, however many hours prior to the publication time that you need. Does that make sense?
It does, but
Well, then let's make it 5 hours before.
also almost 8 o'clock, and I'm not.
Not on all cylinders.
Yeah.
We can make it 5 hours before the agenda is due, which is noon.
Yeah.
The way we're running right now.
Yes.
Let's do that for now. We can always change it. These are changeable anytime. So that's the thing. Or the chair can call something to change at any time, the way this is written, I believe. So let's just change that. Board members shall make requests electronically 5 hours before the agenda. Let's see, before the agenda is
The agenda is to be published.
to be published. Yes.
And then down at number 3.
And in 3, it's going to just say available to each member 48 hours before the board meeting.
Right, I got that one.
So that
Okay.
is that
Yeah.
okay, Mr. Mayor? Is the second.
So Dr. O'Brien, you're
Yes.
offering as a friendly amendment, and I believe Mayor Jacobs was your second, or is that?
Yes, I'm fine with that.
Mayor Jacobs, you're okay with that. So what we're looking at then is that small amendment to the overall set of rules. Further discussion.
So I have a few more things.
Okay.
So page 9, Rule 3, Secretary of the Board, Section A. I would like to add the Secretary of the Board or designee shall prepare.
Accepted as a friendly amendment.
Thank you.
Second.
Thank you.
You got that one already?
Okay. Give me a moment. Let me make sure there aren't any others.
While we're there, we may want to stay in that section no later than 48 hours before the following regularly scheduled board meeting. Take the Monday out and put 48 hours.
Okay.
And again, Dr. O'Brien and Mayor Jacobs, we're okay with that.
Yes.
Good. Okay.
And that completes my discussion item.
Okay. So we're discussing still the motion to approve the rules as amended. Any further discussion on the motion to approve?
Dr. Gocher, I have two, this is Shamiyeh, just two very quick questions. One is simply or actually more of a comment, but Dr. Buchanan, I just want to make sure that with the whole Monday deadline, those slides, which are not a specific, it's not adding to the agenda, they're just informational, I think are going to be hard to get. First of all, they need to be as timely as possible, which means the later we do them, the more they reflect reality. But I don't know if those are included in that. I didn't take it that way, but I wanted to ask.
Technically, they are part of the agenda. I mean, because they're part of the presentation. And I understand that, but I'll be honest, it is a challenge. Getting them late is a challenge for my staff to get them on there. We'll accept them. I mean, if the chair is okay with accepting things later, then we can accept those. I think it's more agenda discussion items that need to be on there and published for the public to see them to decide if they want to come to the meeting. Is that correct, Mr. Sanders? Kind of the concept of timing.
So repeat your question. I didn't quite understand it.
He's asking, so Dr. Shamiyeh is asking about the slides that he puts together for each meeting. He doesn't get them into us usually until day of, I don't think. I'm not sure, honestly.
Right. Yeah, because that way they're as timely as possible. They're as relevant.
Wondering if that's a problem.
No. So what needs to be publicly noticed are issues that you're going to vote on. And that's a report. I mean, it'd be nice if the contents of the report were available 48 hours in advance, but you're not taking any action on a report to you. It'd be no different as if he had no slides at all and just came to you and verbally reported. So no, I don't think you need to worry about not having the documents of his report available 48 hours in advance. What concerns me from a public notice point of view is if the public doesn't have notice of a document, a regulation you're considering.
Thank you.
Okay, thank you. And my other question was simply, I just want to clarify. So this document doesn't change. Clearly, the rules around the vote are important. And so we have 9 members. If I understand correctly, it takes 5, regardless of who's here, as long as we have quorum, it takes 5 to pass a motion. Is that, I was looking back through, I know we discussed that, I couldn't find it again, but does that change based on this document, or is it what we've already been operating within?
That's what you've been operating under, and that's what's in this document. Is it takes a majority of the membership to enact something, not just a majority of those present.
But it describes the membership as being 9.
It doesn't specifically describe the membership as a certain number. It simply states the majority of the membership. It'd be up to you all to know who's a member.
Understood. Thank you.
Other discussion, questions on the motion to approve the rules of the Board of Health? Anything else to go over? Any loose ends? If not, if we are ready to vote, this is voting for, again, approval of the Knox County Board of Health rules as a vote in the affirmative. And Dr. Buchanan, if you'll go through the roll call, we'll go ahead and vote on this.
Sure. Dr. Drake. Nope, she left. Sorry. Dr. Gocher.
Yes.
Dr. Hurt.
Yes.
Mayor Jacobs.
Yes.
Dr. Shamiyeh.
Yes.
Oh, Dr. O'Brien, I skipped you again. I'm so sorry.
There's no specific order. It's a yes.
Thanks. Dr. Souser's not present. Ms. Wagner?
Yes.
And I haven't been voting because I had historically been told I was not a voting member. So after this discussion and while we were discussing, I actually reviewed the Tennessee TCA and all that stuff. So I vote yes too, Dr. Buchanan.
So we have voted unanimously among the folks who are there. So we have passed these Board of Health rules. And thanks everybody for all your input and making those rules a little more tight. Other business, is there other business to come before the Board of Health this evening?
Mr. Gocher, could I just make a public announcement, please, based on public forum from last week?
Certainly.
So thanks to Ms. Meyer bringing up the computers and libraries. Those will be available next Monday, September 14th. Of course, there'll be limited usage and some requirements, but we will have the computers back in the library. So I'd like to thank her for bringing that to our attention.
Any other business in this category? Any other things to bring up this evening?
So if I could interject, this isn't actually business, but I just thought I'd follow up on what Dr. Buchanan did. Dr. Buchanan's an ex officio member of the board. That means she holds her position by virtue of her office, but that does not take away her voting rights. She has always been a voting member of this board should she have chosen to exercise the vote. And I just said she voted for the first time, to my knowledge, tonight. I just wanted to go ahead and let you all know that, so, and let the public know that, so there wouldn't be any question about it.
Thank you.
Well, actually, Mr. Sanders, I do have a question about that. So she can vote or not vote as she chooses, or